Now, on the global research to establish whether or not COVID-19 can be airborne, the Director General of the Nigeria Center for Disease Control, Dr. Chikwe Hekwazu, says that in today's briefing, it cannot be ruled out as new evidence emerges and guides the national COVID-19 response. We have Dr. Aboyowa Edukugo. He's a field epidemiologist, African Field Epidemiology Network, Afrinet. He joins us from Abuja studios. Thank you for joining us at this time. I'd first like to begin with your thoughts on the growing scientific and the evidence of COVID-19 as being airborne, an airborne infection. If there is this increasing evidence, are we fighting the virus the right way?
Okay, thank you, Melissa, and thank you for having me. Like it's been said over the time that this is new. The disease is new, and the virus is also new, and so every day researches are ongoing to get more facts and more facts about how the disease is evolving and is growing. And of course, these facts that we get every day helps us to be able to attack and tackle the disease as it goes. So from reports, it looks like since we have more transmission, more community transmission, even at this time, it looks like there's something that is bigger than just the air droplet that we have always known about. But of course, so since researches are going on, it looks we'll be able to get more evidence to be able to see how to control the disease better.
All right. Now, the Presidential Task Force has been giving its brief sort of mid-term strategies to the COVID-19 fights, highlighting some deficits in the response as well. How would you score them?
Well, the Presidential Task Force is not working based on just they are working on facts. They are working on evidence. They are working with scientists. They are working with people who are doing researches. And of course, as you go on in this fight of fighting against the virus, you need evidence to be able to prove, to be able to get through and get success in what you do. So the gaps you have identified is not their fault. It's because the virus is evolving. A lot of things are going on. Like I said, researches all over the world, research over in the country, and new evidences that bring to bear what should be done will always supersede what has been done before. So as it were, yes, there are gaps, but of course, when you recognize that gaps are there, what you do is to be able to fill them. And with what is being said, what has been known about this time, those gaps will be filled appropriately.
What do you think we need to improve in our response? The WHO was briefing today and talked about how some governments and leaders across the world are sending mixed signals, and that might be hampering the fight towards curbing the spread of the pandemic.
Well, I think that people have to be very careful with the source of information or where they get their information from. Across the world, across the globe, we know that WHO website is important, and that will give information that is needed. And also in our country here, Nigeria, the NCDC website, the microsite, the COVID microsite is a very important place where source of information to get on COVID. So let's not look for information where information cannot be found. Don't just look. Anybody can wake up and post things on social media. But when you want to get authentic information, you go to the right place to get this information. For us, like I said, NCDC website, they have the COVID microsite. It's a very good source of information. I think the state house also has its website, and we can also go there. The WHO website is also rich in information. So when we do this, we should get information from the right sources and not just anyone. People post things they want to post, but getting the right information, we give you the right steps to be able to address and control this disease.
Indeed, information is key, but also when it comes to funding, is there an economic cost of not providing adequate funding? And if we look at from the angle of frontline or last line workers, we've seen health workers across Nigeria at different times in the pandemic cry of being owed salaries or salary slash or poor insurance or lack of hazard allowances. I mean, the list goes on and on. Why would you think this is still a problem? And, do you see us going past this?
Oh, like we all know, I think the federal government is at it, and it's working from what the presidential task force, when the Minister of Health was talking, I think he mentioned, for him, I think he felt he was surprised by the people who have not been paid, and he has made adequate provision for people to be able to write to him directly, and he will see to all of these things. And I want to believe, and I know that the government is working at the federal, at the state level to be able to see to the welfare of these frontline workers. Like we all know, we all said this just came as an emergency, and of course funds are being pulled everywhere to be able to control and to be able to attack this pandemic that we have. And of course the health system is not also left out of it. So, but I know there are good efforts in the right direction to be able to see that things move smoothly. Funds are being generated, are being pulled out, and pulled into the sector to be able to see that the welfare of the frontline workers is adequately taken care of. And we must note that it's not just about the funds. The welfare of workers goes just beyond the funds. It's also talking about their safety in the hospitals, in the primary healthcare center. And of course, we know that recently, about a month ago, the MPACDA conducted a training to show the IPC training to see how health workers also can be protected when rendering these services at that particular level. So right. There was the training is going on across the level from the national to the state and to the local government level, even to the ward levels, to see how health workers can be protected when also rendering their services. So the welfare does not just talk about money alone. It talks about so many other things that are going at the background that people are not really aware of.
We'd like to thank you. Thank you so much, Dr. Aboyowa Edukugo, Field Epidemiologist, African Field Epidemiology Network. We'd like to thank you for joining us at this time.
Thank you for having me.